What is MRSA? Strains of Staphylococcus aureus that are resistant to certain antibiotics.
MRSA stands for methicillin-resistant Staphylococcus aureus. Basically, it's a type of skin infection that usually starts out in an area of injured skin and can look like a boil, pimple, or even a spider bite. The infection rapidly becomes worse, and it can be very tender, painful, and warm.
What is Staphylococcus aureus? Staphylococcus aureus, or staph, is a very common bacterium. Staph is a spherical bacterium which, on microscopic examination, appears in pairs, short chains, or shaped like grape clusters. These organisms are gram-positive. Some strains are capable of producing a highly heat-stable protein toxin that causes illnesses in humans. About 1 in 3 people have staph on their skin or in their nose. The most common place to have staph is in the nose. There are over 30 types of staph infections. Staph was discovered in Scotland in 1880 by the surgeon Alexander Ogston in pus from a surgical procedure. Staph is usually harmless, and most people who carry it are unaware that they have it. However, sometimes the bacteria will get inside your body through a wound and cause an infection. Antibiotics are given to kill staph germs when there is an infection. However, when they don't kill the staph bacteria, it means the bacterium has become resistant to the antibiotics. This type of staph is called methicillin-resistant Staphylococcus aureus, or MRSA. When was MRSA discovered? MRSA was discovered in 1961 in the United Kingdom. The first time MRSA observed in the United States was in 1968, an outbreak at the Boston City Hospital in Massachusetts. In the early 1980s was when MRSA was found more regularly in the U.S. Hospital-associated MRSA and community-associated MRSA. Anyone can get MRSA. Infections range from mild to very serious. It can even be life-threatening. MRSA is often subcategorized as hospital-associated MRSA or community-associated MRSA. Hospital-associated MRSA are patients who undergo invasive medical procedures and who have weak immune systems and are being treated in hospitals and healthcare facilities. MRSA in healthcare settings cause more of a chance to be serious and life-threatening infections, such as bloodstream infections and surgical site infections of ammonia. The main mode of transmission to other patients is through human hands. Hands may become contaminated with MRSA bacteria by contact with infected patients.
The truth is, MRSA has been around for years, but it was generally only found in ill people in the hospital setting, and now it's gotten a little stronger. It's moved out into the community and the general population. It is what we call community-associated MRSA.
MRSA infections that occur in healthy people who have not been in the hospital for the past year are categorized as community-associated MRSA. These infections are usually skin infections such as boils and other pus-filled lesions. Anyone can get community-associated MRSA. Outbreaks have been seen in people who are in close quarters, for example, in athletes, in schools, in college dorms, or military barracks. MRSA is contagious. People can have the bacteria on their body for days, weeks, or even years. How can MRSA be spread? People who are referred to as MRSA carriers means the individual carries the organism in or on their body and may transfer the organism to another person who may become infected. MRSA can be contagious and be spread by 2 major ways. The first way is by direct contact with someone who is infected or a carrier of MRSA. The second way is by indirect contact, when people touch objects that carry MRSA bacteria from an infected person and can spread that bacteria to uninfected individuals. Some examples are doorknobs, towels, clothing, sinks, or gym equipment. How can the bacteria be prevented? To prevent MRSA infections, individuals need to practice good hygiene. Keep your hands clean by washing thoroughly with soap and water. Keep wounds and cuts clean and cover until they're healed. Avoid contact with other people's wounds and avoid sharing personal items. MRSA in pregnancy. Pregnancy and MRSA. If a woman has been diagnosed previously with MRSA and if she is having a planned C-section, she has a high risk for complications. Pregnant women who get MRSA infections are treated with antibiotics. If they pass MRSA to their infant, the baby can also be treated. Fortunately, it is rare in infants. A deeper look into antibiotics and beta-lactams. The antibiotics that are resistant to MRSA are called beta-lactams. The antibiotics include methicillin and others such as oxacillin, penicillin, and amoxicillin. MRSA is also known as multi-drug resistant Staphylococcus aureus and oxacillin resistant Staphylococcus aureus. Antibiotics is a chemical substance produced by a microorganism which has the capacity to inhibit the growth of or to kill other microorganisms. Antibiotics sufficiently non-toxic to the host are used in the treatment of infectious diseases. Beta-lactams whose chemical structure contains a beta-lactam ring. Beta-lactam antibiotics target the penicillin binding proteins, a group of enzymes found anchored in the cell membrane, which are involved in the cross-linking of the bacterial cell wall. The beta-lactam ring portion of this group of the antibiotics bind to these different binding proteins, rendering them unable to perform their role in the cell wall synthesis. This then leads to death of the bacterial cell due to osmotic instability or autolysis.
Beta-lactam antibiotics include all penicillins and cephalosporins that contain a chemical structure called a beta-lactam ring. This structure is capable of binding to the enzymes that cross-link peptidoglycans. Beta-lactams interfere with cross-linking by binding to transpeptidase and D-alanine carboxypeptidase enzymes, thus preventing bacterial cell wall synthesis.
In 1943, penicillin became the first widely used antibiotic. In 1945, more than 20% of the staph strains were already resistant to penicillin. This bacteria had an enzyme called penicillinase that could destroy penicillin. In 1959, doctors started to use the antibiotic methicillin, but within 2 years, methicillin-resistant strains of staph appeared. What is the mecA gene and SCC-MEC? Methicillin-resistant is the most common known carrier of the mecA gene. The mecA gene is the gene found in the bacterial cells. The mecA gene is responsible for the methicillin resistant and is part of a mobile genetic element found in many MRSA strains called SCC-MEC. SCC-MEC is a family of genetic elements that carry a copy of the methicillin resistant gene, mecA, into the chromosome along with the genes required for the integration and excision of the element. All MRSA strains carry at least one SCC-MEC element in the chromosome. Summary. We need to know that MRSA is all around us, in our hospitals and even in our communities. MRSA is resistant to virtually all beta-lactam antibiotics. The mecA gene is the gene responsible for the methicillin resistance. To prevent MRSA infections, we need to be practicing good hygiene.